Hi everyone. So in week 14 we have topic burn, and that's the only topic we need to discuss about in week 14. So let's just get started. So I have tried to go over the most important thing we need to know about the burn and even tried some of the question. So we'll have an idea what kind of question to expect from this portion. Starting with the burn, the first thing we need to know is type of burn. Thermal burn, chemical burn, electrical, radiation. Those are the thing which is really common. We all know about that, but I just want to take a little bit of the time and go over one specific kind of burn, which is your smoke inhalation, which mostly happen as a result of a burn. And to be more precise, in this smoke inhalation, I want to talk about the carbon monoxide poisoning. While we did our exam, we had one question about the carbon monoxide, and even in your study guide, um, they ask you about what carbon monoxide poisoning is, what's the sign and symptoms, and what's the treatment method. So the reason why carbon monoxide is kind of important is because of the fact that we have hemoglobin. We know that hemoglobin is present in the red blood cells, and hemoglobin is what carry oxygen to the whole body. But when a person is in the situation with the burn, then some of the particles which is not totally burned produces the carbon monoxide, and the carbon monoxide binds to the hemoglobin really stronger than the oxygen. It has 200 250 times more binding capacity than the oxygen. So what will happen? There will be oxygen, there will be the carbon monoxide. Carbon monoxide will take the place and bind to the hemoglobin. And now you have that carbon monoxide binding to the hemoglobin floating throughout your whole body, and as a result your tissues are not getting enough oxygen, leading to be hypoxia. And it can cause us to have the worsening tissues damage as well. Carbon monoxide poisoning is kind of really fatal because it can cause us to have metabolic acidosis, and as well as it is not easily detected sometimes. So issue-wise, it can cause us to have metabolic acidosis, hypoperfusion, and injury. When we talk about how to assess for the sign and symptoms, even with the pulse ox, we will not get a good idea if a person is having the carbon monoxide. So the thing which we need to do is we always want to check with the arterial blood gas. It will give us some kind of idea. The classic symptom include confusion, nausea, vomiting, headache, inhalation injury, and this one is very rare, but in the NCLEX and in the ATI, this is the word they're looking for: cherry red skin coloration. If your skin coloration is like cherry red, it means that person had carbon monoxide inhalation. Treatment: be really aggressive with the oxygenation. Give 100% oxygenation and escalate the hyperbaric oxygen therapy. So the treatment wise, give them plenty of oxygen. That's the only therapy we have. So from this slide, I want you to know that there are different type of burns such as thermal, chemical, electrical radiation, smoke inhalation. And in the smoke inhalation, carbon monoxide poisoning is one of the fatal one because it binds to the hemoglobin and pushes away the oxygen. If there is no oxygen, tissue will start to die because the place of oxygen has been occupied by the carbon monoxide. Classic sign: cherry red skin coloration. Treatment: 100% oxygen and hyperbaric oxygen therapy. Now, the second topic we have is, whoops, that's a mistake, is the classification of burn. So we have several types of burn, but before we go into the types of burn, let's just get started with just the basic idea of the different layer of the skin. We know we have epidermis, dermis, and subcutaneous tissue. Epidermis is like the top layer, which is just the protective layer. Dermis is kind of thick. It has the connective tissue and contains the blood vessel, nerve ending, sweat gland, and so on. Whereas subcutaneous is your deepest layer, and technically it's not a part of the skin, but it supports the skin, made up of fat, connective tissue, and acts as a cushion. So three layers of skin: epidermis, dermis, and subcutaneous. Now let's talk about the classification of the burn. So we have four major types of burn. Number one is your first degree burn, which is just a superficial burn. It only involves the epidermis, so the top layer of the skin is only affected. Example for this one is sunburn. The other one is your second degree, which involves epidermis as well as some part of dermis. These are the blister, red to white appearance, and could be painful. Third degree burn, that's when things becomes more serious. It involves entire epidermis, entire dermis, as well as some of the subcutaneous tissue, and it requires grafting to heal. So we have heard of fish grafting, skin grafting, and those kind of things. Fourth degree is the one that extend into the muscle, bone, tendon, and have the blackened appearance, may require amputation as well. So the fourth degree is really, really severe. Okay, so far what we have learned, two things. We need to know what are the different types of burn, especially the smoke inhalation, and the second one is the different classification of the burn. Now we have something called rule of 9, and I have no idea where this number are all off. The rule of 9 is really important to calculate the amount of body surface that has suffered a burn. Now, why is that important? It is needed because it tells us how severely the burn is and how much of the fluid replacement we need to give during the first 24 hours. Because one of the things that happens with the burn is the imbalance of fluid and electrolyte. And once we calculate the body surface area that has been burned, we use the formula called Parkland burn formula to determine the amount of fluid replacement needed. Because the patient can go to the hypovolemic shock, so we need to assess that and treat it quickly. Usually, if the patient have 15 to 25% of the burn, then they need to have the fluid replacement ASAP. Now, why do we need to replace the fluid, or why does we need to calculate the total surface area that has been damaged? Because when you have the burn, if it is partial thickness or more, the capillary membrane permeability increases, which causes us to have sift of fluid from our first space into the second space, leaving the heart with barely anything to pump throughout the vital organs such as your kidney, your brain, and so on. This can cause us to have death. So it is really, really important to know the amount of total surface area that has been burned and replace the fluid accordingly. So when we talk about the rule of 9, we have the rule which we have divided the whole body. So our whole head and neck, the whole thing of the whole head, rotate your head, the whole thing consists of the 9%. Anterior is 4.5, posterior is 4.5. Your right arm is 9%, left arm is 9%. Right leg is 18%, left leg is 18%. Front of your trunk is your 18%, and the back of your trunk is another 18%. And lastly, your perineum is 1%. One more time. Your hand, right and left hand, and neck, they are 9%. If you'll divide it by 2, it will be 4.5 in the front and 4.5 in the back. That's why we have anterior and posterior. Whereas your trunk is your front and the back. The front is 18%, which includes your abdomen and chest, and back is your another 18% posterior, which includes the back of your chest and back of your trunk or abdomen. Leg is 18%, 9% on the front and 9% on the back, similar to the other one. And perineum area is your 1%. Total combined, it consists of 100%. The other topic we have, the fourth topic we have, is the different phases of burn. And the most important phase is your emergent phase. That's the first 24 to 48 hours. Priority is A, B, C. We want to do the fluid replacement using the Parkland formula, which says 4 mils times the body weight times the percentage of total body surface area that has been burned. Once we calculate that, we divide it into two separate parts. The first amount of fluid has to be, the half of the fluid that is calculated has to be given in the first 8 hours, and the rest half has to be given in the 16 hours. In the other way, if there is a fluid that is 2400 ml, let's say we found out that 2400 ml fluid needs to be replaced, then half of 2400 is 1200. 1200 has to be given in the first 8 hours, and the rest of the 1200 has to be given in the next 16 hours, if that makes sense. Again, why do we give it? To prevent the shock and manage the pain. We need to assess for any inhalation injury as a result if a patient has inhaled any of the carbon monoxide or any of the toxic fumes. The second phase is acute phase. Couple of things to be mindful about is this phase begins after the fluid resection, lasts until the wound closure. So this phase is not severe. This one is more like preventative measure. We try to prevent the infection, we do the wound care, pain control, nutrition, high protein, and most importantly, physical therapy. Pay attention to this physical therapy. The other one is your rehabilitative phase, which focus on recovery and restoring the function, includes the scar management and psychosocial support. So out of the three phases, our emergent phase is really important because that's the phase where we calculate the amount of the fluid and we replaced it. We find the amount of the fluid by the alkaline formula, divided by 2, give the first half in the first 8 hours and the last second half in the next 16 hours. We want to also do the pain management, for which we use the IV narcotics, sedative, anti-anxiety meds in a small dose. And that's like a basic thing we need to know on the burn. So altogether we have 5 topics in this one. The first one is type of burn. We talked about this. Smoke inhalation was one. Carbon monoxide poisoning is kind of really something we need to pay attention to. It's fatal because it binds to the hemoglobin, dislodges the oxygen, and without oxygen the tissue become hypoxic and die. Symptoms: cherry red skin coloration. Treatment: 100% oxygen. On the types of burn, you have superficial, which is just the epidermis. Partial is epidermis plus dermis. Third degree burn is epidermis, dermis, and some of the subcu. Fourth degree is the one where you need to do the amputation. It's so severe. Rule of 9 just tells us how much of the total surface area of the body has been damaged as a result of the burn. Head include 9%, right and left arm includes that 9 and 9%, trunk 36%, front 18, back 18, perineum 1%, right leg 18, left leg 18, 9 in the front, 9 in the back, altogether makes 100%. Emergent phase is the one where you calculate the amount of fluid needed to be replaced, divided by 2, give the first half in 8 hours and the next half in the rest of the 16 hours. Now let's practice some of the question. A patient arrives at the ED after being trapped in a house fire. The patient burned covering the anterior chest, anterior abdomen, and both anterior arms. Use the rule of 9. What percentage of the patient total surface area is burned? You can pause it here and try to see if you can get it right. Okay, now since you have done it, let's read the question one more time. The patient has burns covering the anterior chest, anterior abdomen. So if you'll see, anterior chest and abdomen makes your trunk. Anterior trunk, combine both of them together, which consists of 18%. And now it says both anterior arms, means right and the left. Your right arm consists of 9%, left arm consists of the 9%, but it says only the anterior, meaning the front, which is 4.5 on the right and 4.5 on the left. So altogether, if you'll calculate 18 plus 4.5 plus 4.5, you will get 27. So the answer to this question is 27. Okay, question number 2. A burn patient in the emergent phase is receiving the fluid resuscitation using the Parkland formula. The patient weight is 70 kg and has burn coverage covering 40%. How much fluid should be infused in the first 8 hours? We know the formula. Take your time. Okay, now you have done it. The way to solve this is, we know the Parkland formula is 40 times patient weight times the amount of body surface area that has been burned. So 4 times 70 times 40. Let's do the math really quick. I'm going to use my calculator and see how much I get. 4 times 70 times 40. I have 11,200. That's the total amount of the fluid they have to be given in 24 hours. If I divide that by 2, I get 5,600, which needs to be given in the first 8 hours. So B is your answer here. Okay. Question number 3. A patient with the full thickness burn on both legs developed a urine output of 20 mils per hour, blood pressure of 85/55, and a heart rate of 135. What should the nurse do first? Okay, So we can see that the urine output is 20. We know that that's not normal. That's urine output is low, blood pressure is low, heart rate is high. It means the patient is coming to become the hypovolemic shock. The patient is going to the hypovolemic shock. The one way to manage that will be increase the IV fluid rate. If we can do that, it will help us with the hypovolemic state. So the answer to this question will be A, increase the IV fluid rate. Okay. A patient with the electrical burn is being monitored for complication. Which of the following is the most concerning and require immediate intervention? Our immediate intervention will be, take your time. Okay, now since you have done it, our answer will be serum potassium level of 6.0. If you'll go back to level 1 and think for a second, we said we have too much of the potassium in the cell, and outside the cell we have too much of the sodium. But once your cells starts to burn and die, those potassium from the cell will dump into the blood. As a result, your potassium will become elevated, and potassium of 6.20 is kind of fatal. Not fatal, but it will cause a lot of complication which can cause us to have death. So we want to treat that immediately, and it could be even fatal. Which intervention should the nurse include in the care plan for a patient in the acute phase of burn recovery? So we said we have emergent phase and then we had acute phase. In the acute phase, monitor for signs of airway obstruction. No, that's we do in the emergent phase. Administer tetanus prophylaxis, we do that, but that's not in the acute phase. Perform daily wound debridement. Begin the physical therapy to prevent contractures. Yes, we said we have to pay attention with the physical therapy in the acute phase. Last but not the least, a nurse is caring for a patient who sustained inhalation injury in a house fire. Which assessment finding is most concerning? And you can all get this one. And the answer to this question will be hoarseness and breathy cough, because that shows that there is some kind of obstruction in the airway, and we always go A, B, C. So this one will be the one which we have to be most concerning about. 91 is low, but still more than 90, so we're not super worried. So A and C is something which we look for, but A is the one that causes us to cause the patient to have more immediate concern. And that's all. Whoops, my bad. I think I have one more. A patient in the emergent phase of burning management develops confusion, restlessness, and a headache. What action should the nurse take first? So in this one, a patient in the emergent phase of burning management develops the confusion, restlessness, and a headache. What action should the nurse take first? If you'll think about that, in this one, we have confusion, restlessness, and headache, and it's in the emergent phase. It means that it is the phase where we need the immediate intervention. And the answer to this, assess for inhalation injury. Okay, we want to do that. Administer IV fluids. Yes, you want to do that. Notify the healthcare provider. You want to do that. But what's the first thing you want to do is check the carboxyhemoglobin level to see if there is a carbon monoxide poisoning. So you want to do that. That's the first thing you want to do. Okay, that's all we have in the burn. If you have any question, please leave me the message in the group chat and I'll try to see if I can answer them. And I'll see you in the next PowerPoint.